Indiana's Medicaid overhaul includes policies like establishing work reporting requirements for the Healthy Indiana Plan, or HIP, and increasing eligibility checks for Medicaid members. Both will likely result in people losing coverage. Now, changes being proposed at the federal level are adding even more uncertainty. Leo Cuello is a research professor at Georgetown University Center for Children and Families. He says federal lawmakers are looking to cut Medicaid costs through dozens of policies, including their own version of work reporting requirements for Medicaid expansion programs.
I don't think many people yet understand the impacts. They may not understand it until they lose their health insurance.
The federal changes are tied to hundreds of billions of dollars in proposed spending cuts to Medicaid. Republican lawmakers say they need to reduce federal spending to pay for the Trump administration's tax cuts. But if an estimated 230,000 Hoosiers lose health coverage due to the changes, that would likely create additional problems elsewhere. Foundation's Family Medicine is in Austin, Indiana. About 60% of its patients are Medicaid members. Dr. William Cook serves as its medical director. He says when people lose coverage, they stop seeking preventative care. Cook says hospitals and the state may end up footing the bill for the more expensive emergency room visit or a larger public health emergency, which in rural areas could be enough strain to result in closures.
We're really pushing this budget downstream, and we're going to pay for it in the end. I think it's a little short-sighted.
Teresa Woodard has been a patient of Cook's for years. She says many families in Austin, including her own, rely on Medicaid.
In small rural places like this, it would be traumatic. It would affect so many people that depend on it for their medical care.
Foundation's Family Medicine is the only primary care provider in Austin. If the changes affect the practice, Woodard and many others in the community would have to choose between traveling further for care or not seeking it at all. Medicaid members say they have to live with the life or death consequences, whatever lawmakers decide.
It's something that's going to devastate small areas like this and others.
For Indiana Public Broadcasting, I'm Abigail Ruhman.